If your calves feel like they're going to explode 15 minutes into a run, stop stretching immediately. You might be suffocating your muscles from the inside out. Most runners assume tight calves mean short muscles. But in chronic exertional compartment syndrome, CECS, your fascia is like a sausage casing that is physically too small for the meat inside. As you run, blood flow increases muscle volume by up to 20%. Since the fascia doesn't expand, internal pressure skyrockets, crushing veins and nerves until your foot goes numb or drops. Here is the trap. You treat this like a strain. You foam roll, you ice, and you stretch aggressively. But you cannot stretch fascia into expanding. In fact, static stretching often irritates the nerve structures that are already being crushed by that internal pressure. You are essentially pulling on a compressed nerve. To confirm this diagnosis, we don't look at an MRI. We have to stick a large needle with a manometer directly into your muscle while you exercise to measure the mercury levels. Before surgery, we try gait retraining. The goal is to alter biomechanics to offload the specific compartment that is suffocating. If biomechanics don't lower the pressure, the answer is a fasciotomy. We surgically slit the sausage casing open to give the muscle room to breathe. It sounds extreme, but it's the only way to save the tissue. Pressure kills performance. Diagnose it, don't stretch it.